Hello, I'm Dr. Jenny Andrus, and welcome to Joint Ventures. In this OSC original podcast, we take a look at recent medical news and headlines to bring you the facts you need to make the best decisions about your healthcare. In orthopedic medicine, so much of what we treat is age-related changes. Joint wear, joint tear, worn-out discs, bursitis. And rarely a day goes by when a patient doesn't joke that what they really need from me is a new body. Whether it be our skin or our joints, we all want to stay young, don't we? The anti-aging business is booming and expected to be about a $100 billion industry by 2030. But what if the key to youth is just a simple, inexpensive, readily available vitamin? Sounds too good to be true. Well, a recent study suggests that vitamin D is in fact a key to anti-aging. Whoop whoop. A recent study published in the American Journal of Clinical Nutrition looked at telomere length in people on vitamin D, as well as omega-3 fatty acids. Now, telomeres are these end caps on your chromosomes, and they protect the chromosomes' integrity and stability. With each cell replication cycle, these telomeres naturally shorten. Cells that have very short telomeres die easier and are less stable, and that's proposed to lead to an increased risk of chronic disease, cancer, cardiovascular disease, and mortality. This is obviously then a lot of interest in what factors could slow down the telomere shortening and subsequently prevent premature aging or age-related diseases. This study was a randomized, placebo-controlled trial looking at vitamin D3, 2,000 IUs per day, and fatty acids 1 gram per day for 5 years with over 25,000 people. The authors found that vitamin D supplements for 4 years resulted in more preserved telomere length compared to placebo. Vitamin D for 4 years prevented nearly 3 years of telomere shortening. Omega-3 fatty acids didn't impact the length. They also found that the rate of autoimmune disease and cancer was lower in the vitamin D group. What does vitamin D do for your body anyway? Well, most of us think vitamin D in its relation to bone health, especially in orthopedics. Vitamin D promotes calcium absorption in the gut and maintains adequate blood calcium and phosphate to enable normal bone mineralization. But it's also important for reducing inflammation and in modulating cell growth, neuromuscular and immune function, and glucose metabolism. In fact, genes that regulate cell growth, differentiation, and death are modulated in part by vitamin D. So it's not just for your bones. Vitamin D is broken down in the liver into 25-hydroxy vitamin D and in the kidney to 1,25-dihydroxy vitamin D. The 25-hydroxy vitamin D is what is measured because it has longer half-life. Less than 30 is considered at risk for bone problems. Less than 50 is considered low, and you probably want to see a level of 50 to 125. How much vitamin D do we need to ingest anyway? Well, this varies by age and sun exposure. Between our inside jobs and everybody covering up to prevent skin cancer, the recommendations typically are based on people with low sun exposure. From 18 to 70 years old, the recommendation is 600 IU, and over 70, it's 800. So how do we get an adequate amount of vitamin D in? Well, vitamin D is present in some foods. It's added to a lot of others, and your body makes it when sunlight strikes the skin. Now, when we talk about vitamins and minerals, experts almost always say dietary sources are best. So what do you eat to get it? Well, not a lot of foods have vitamin D, actually. Fatty fish are a source, but if you are like me and you will pass on salmon and trout, you can opt for beef liver, and I'll skip that too. In the Americans' diets, a lot of our food, though, is fortified, and that's predominantly milk. Breakfast cereals are also typically fortified, and soy and almond milk is often fortified as well. Sun exposure would be another way to get your vitamin D. However, the season, the time of day, your skin melanin content, and your sunscreen use all play a role. And as we age, we are less able to convert that sunlight into vitamin D. And just opening windows or shades won't work because it doesn't get through the windows. So you can imagine being indoors and not eating a lot of fortified foods could lead to deficiencies. But what else? Well, if there are kidney issues that don't allow you to convert to the active form, or GI issues that don't allow for absorption, for sure. Since it's hard to get vitamin D from food or sunlight, many people need to take supplements. Exclusively breastfed infants, older adults, and people who are homebound or who don't go outside uncovered are obviously at more risk. And vitamin D is fat soluble, so its absorption depends on the gut being able to absorb the dietary fat. Medical conditions like inflammatory bowel disease or cystic fibrosis or liver disease, as well as people who've had gastrointestinal surgeries like gastric bypass surgery, are at risk. Obesity itself is a risk factor, as the vitamin D can actually get sequestered in the fat. Now, what does deficiency look like? Well, rickets is fortunately rare in our country, and it occurs in children, resulting in failure of bone tissue to properly mineralize, resulting in soft bones and deformities. And in adults, the deficiency can lead to osteomalacia, where the existing bone is incompletely mineralized during remodeling, and that results in weak bones. Now, rickets and osteomalacia are the result of vitamin D deficiency, but osteoporosis, which is typically age-related, is in part a long-term effect of calcium deficiency. Vitamin D insufficiency, however, contributes to this by reducing your calcium absorption. So vitamin D is necessary for muscle fiber growth, and deficiency can lead to muscle weakness and pain. No studies have shown reduced fracture risk with vitamin D supplementation alone, and most focus on calcium with vitamin D. We talked about that before in another podcast. Bone health is a given, but vitamin D can prevent other health problems. Well, maybe not. The data's not great there. In general, studies on cancer and vitamin D aren't conclusive, so to date, there's not a consensus on supplements to prevent cancer. And while studies have not consistently shown reduced cancer rates in those on vitamin D, they do suggest that higher levels of vitamin D might reduce cancer mortality. Now, cardiovascular disease is a leading cause of mortality in the U.S., and vitamin D helps to regulate blood pressure through the renin-angiotensin-aldosterone system, as well as vascular cell growth and the inflammatory and fibrotic pathways. Vitamin D deficiency is associated with arterial stiffness and hardening and high lipids. Despite this, there isn't current data to support vitamin D supplementation to reduce cardiovascular disease risk. Vitamin D plays a role in glucose metabolism, so it stimulates insulin secretion, it reduces peripheral insulin resistance. Type 2 diabetes is a huge risk factor for cardiovascular disease, so can vitamin D supplements improve diabetes or risk of becoming diabetic? Well, as of now, the clinical trials really haven't shown that either. No major positive benefits in the prevention or management of diabetes with supplements. As with everything, you can absolutely have too much of a good thing, and excessive vitamin D results in high calcium, which can cause nausea, weakness, psychiatric problems, and kidney stones, just to name a few. You learn the mnemonic in medical school: bones, stones, groans, and moans. So how much should you take? Well, that depends on your health conditions and your current vitamin D levels. If you get the 600 IU per day, you're reaching the recommended level. While you can absolutely take too much, 1,000 to 2,000 IU seems to be well tolerated, as long as you don't have other issues like high calcium. In the setting of very low vitamin D, your doctor can prescribe a dose of like 50,000 IU, and that's usually once a week. Okay, so maybe vitamin D isn't the answer to all of our anti-aging problems, but this study showing that telomere shortening was reduced in people taking vitamin D, to me, is absolutely astounding. Like a lot of people, I am guilty of not consistently taking my vitamin D, but after reading this, I am back on that train because as a lady of an advancing age, I can use all the help I can get. Thank you so much for listening. I really hope that you learned something here. Please subscribe and share this podcast. We're hard at work making new episodes, and we don't want you to miss out. Wishing you good health. See you soon. Bye-bye.
At Orthopedic and Spine Center, we're dedicated to providing the highest quality treatment using the most advanced technology available. Our fellowship-trained spine and interventional pain management physicians specialize in diagnosing painful conditions and offer minimally invasive interventions to complex spine surgeries. Our pain psychologist helps patients understand and reduce stress from chronic pain conditions. Our experienced physicians get you back to doing what you love. Call today for an appointment. Experience excellence at Orthopedic and Spine Center.